Hi, everyone. I'm Donna Pryor, a partner in the Husch Blackwell Safety and Health Group. Before we begin today, I would like to cover a few housekeeping items. At the bottom of your audience console, there are multiple application icons for use during the program today. So if you have any questions, please submit them via the question box, and you can submit them anytime during the presentation that you like, and we'll try and answer all of them during the webcast, but if we can't and we need to give you a fuller answer, we'll email you later after the presentation's done. A PDF of the presentation is available in the resources folder at the bottom. And wanted to tell everyone this program is approved for Illinois, Iowa, Kansas, Missouri, Nebraska, and Tennessee continuing legal education credits, and Texas and Wisconsin credits are pending. HRCI and SHRM credit has been approved. To report your hours, click on the CEU icon at the bottom of the screen. A certificate of attendance, including your course numbers, will be emailed to you tomorrow, along with a recording of the webcast for watching and sharing. Towards the end of the program, be sure to complete our short survey, and we use your feedback to plan future programs that are applicable to your business needs. So that's all of our housekeeping we have for now. Let's get started with our program. So today, we're going to be discussing what you can expect from MSHA under the new Biden administration. And joining me today is Eric DeLay. Eric's my partner that also works out of the Denver office. Eric's with his co-counsel, Aria, who you can see her ears walking by if she gets up from her nap. Eric focuses on administrative and regulatory law with an emphasis on workplace safety and security in critical infrastructure sectors such as mining, energy, and aviation. So let's get started. Just want to see, I saw the list of who's attending today. Hi, everyone. We have a lot of old friends on and a bunch of new as well, so welcome. So here's what we're going to be looking at today. Who's going to be in charge, what kind of new rules we expect, how will enforcement change, and how can you prepare? So let's jump right in. Who is in charge of the DOL? President Biden has nominated Marty Walsh to be the new Secretary of Labor. Mr. Walsh is the current mayor of Boston, and he's a former leader of Boston's Building and Construction Trade Council, which is an umbrella organization of 20 local unions. And Mr. Walsh is scheduled to receive a confirmation hearing on his nomination on February 4th in 2 days. We've done a little research on Mr. Walsh. We see that he's joined the labor's union local 223 at age 21, and he's been with that union until his election to the mayor of Boston. So he's a long union history. Mayor Walsh's website, current for his position as mayor of Boston, outlines his focus on worker safety during the COVID pandemic. So it's safe to assume that he will begin his time as Secretary of Labor by tackling COVID workplace-related issues. On a positive front, Glenn Spencer, the Senior VP for Employment Policy at the U.S. Chamber of Commerce, has stated, Marty has a reputation of bringing all parties to the table and actually listening. He does want to take into account the concerns of business, and we find that encouraging. So it seems like he has a history of working with both sides of the table, which is great. Who is in charge at MSHA? Many of you might have heard Assistant Secretary Zatazelo resigned on January 21st. And currently, our understanding is Pat Sylvie is the most senior administrator at MSHA. We're hearing a lot of rumors about unions supporting a number of possible appointments. And I'm certain there's a whiteboard out there somewhere with potential nominees, but none of those has surfaced yet as the true nominee for Assistant Secretary for MSHA. So we'll keep you posted. If you are not signed up for our blog, I encourage you to do that, and we can give you that information on how to log on and be a member and receive our updated blog posts, because we'll keep you posted. Who's in charge in Congress? So right now, the House has a Democratic majority, 221 versus 211. You might have heard Senate is a 50-50 split with Vice President Kamala Harris as the tiebreaker. A power sharing deal has been advanced, but we haven't seen any kind of final word on that deal. We just expect committees to be split 50-50 with Democratic chairs. If the vote in the committee ties, they can proceed to a full Senate vote. So we don't have any official resolution on the power sharing deal, and the committee websites haven't changed either. So again, we expect the Democrats who are formally ranking will likely become the chairs of those committees. Some of these committees, I just wanted to remind everyone, if you're a member of the Mining Coalition, you've already met with some of their staffs. And just as a little plug for the Mining Coalition, which is a small coalition of operators and contractors, we do a field trip every year, or this year it'll probably likely be virtual, to DC to meet with folks here. If you're interested in joining the Mining Coalition, please let us know. Next slide. Who's in charge of the commission? The Federal Mine Safety and Health Review Commission, as you know, is the body where our ALJs are as well. The commission is the level that you'd appeal an ALJ decision. So the person who's just been named chairperson is Arthur R. Traynor. Mr. Traynor, or Commissioner Traynor, I should say, has been on the commission since March of 2019. Before that, he was in private practice. And before that, he was the Associate General Counsel of the United Mine Workers of America. The other two commissioners are William or Bill Alfin and Commissioner Regovich. And those two gentlemen do what Eric and I do, or used to do what Eric and I do, and work for industry. There are two more seats that can be filled. Typically, in order to get both of those seats through, they'll pair a Democrat and a Republican together to fill the last two seats. But that remains to be seen. That's just kind of traditionally what happens. How is enforcement going to change? That's the big question. I'm going to go through some slides. I kind of dorked out on some data here, and I'm going to show you what I found. This first slide shows how there's almost 2,000 less mines today than there were in 2006. This likely has a lot to do with mines completing their natural and projected cycles and a reduced demand for coal, as many power companies are feeling pressure to rely more on renewable energy sources. That said, we know that demand for metal and non-metal prices is increasing. A lot of you saw in the news just last week, GM announced that it's aiming to sell only zero-emission cars and trucks by 2035. So what do you need for all those new cars? You need a lot of metal. You also need lithium. We currently have one lithium mine in the state of either Nevada, depending on where you are. And I just read another lithium mine just completed its environmental impact statement for another new mine also in Nevada. Next slide, citations and orders. This slide shows the number of citations and orders issued by MSHA from 2006 to 2019. And you'll see some numbers peaking during the end of the Bush administration in 2008. This is likely in response to the Sago accident in 2006 and the Crandall Canyon accident in 2007. The numbers stay in the 175,000 range per year until after the Upper Big Branch accident in 2010, and then the numbers start to slowly decline and they flatten out during the Trump administration. This slide shows S&S citations and orders from 2006 to 2019. Again, you're going to see the numbers higher in 2006 after the Sago mine accident, and then increased in 2009 during the new Obama administration. And it spikes up in 2010 after the Upper Big Branch accident. And then the numbers declined pretty steadily through both the Obama and the Trump administrations. That's for S&S citations and orders. This slide shows the dollar amount of assessed penalties from 2006 to 2019. Again, you see these numbers spike after the Sago, Crandall Canyon, and Upper Big Branch accidents, and then they decline after 2011, and they flatten out during the Trump administration. This slide looks a little different, and that is because it was prepared by our friend Mark Savitt. Many of you probably know Mark Savitt retired in March, but he's still actively working at his company, Predictive Compliance, and he gave me the next 3 slides and wishes everyone well. So this slide compares the total number of mines in orange with the total citations in blue. And you'll see there's no real correlation between number of mines and the number of citations issued. The number of citations increased during the time of increased scrutiny of the agency and the mining industry after the 2006, 2007, and 2010 accidents, and that's at about 160,000 citations a year. And then the number drops to about 100,000 citations per year during the late Obama and the Trump presidencies. This slide shows lost work days in the blue vertical lines for coal mines and in green for metal non-metal lines. The coal violation count, the total number of violation count is the horizontal line in purple, and the horizontal line in yellow shows metal non-metal violations. Our point here is to show you what many of you might already think, that there's not a clear correlation between workplace safety, actual safety, and citations issued. At least after 2006, the number of citations issued far outweighed the number of lost time accidents. This next slide shows the total number of lost work days over a year compared to 103K orders. So I know a lot of you know what 103K orders are, but just as a reminder for those that are forgetting, 103K orders are issued by MSHA after an accident to ensure the safety of any person in the mine. Any work done after a K order is issued, any work done in a mine has to be approved by the agency until the K order is lifted. Typically, K orders are used when there's been an accident and there has to be a recovery or a rescue, or when there has been a serious ground control issue and MSHA wants to give approval to a plan on how to safely resume mining. So what we've seen over time is a trend to use the K order to get mine operators to do things not required by the regs in order to get the K order lifted. So look at how many K orders were issued from 2008 to 2012. There are more K orders than there are lost time accidents. So how is that? Well, under Part 50, an accident can be an unplanned ignition, a rock burst, damage to hoist equipment that interferes with the use of equipment for more than 30 minutes. In all those instances, there might not be any injuries, but still MSHA can and will issue a K order to control the abatement of the alleged condition. We've seen a trend in continuing to use the K order, and recently I had a client call me just last month where nobody was hurt, but there was, under Part 50 an accident, they had to report it. A K order was issued, they were stopped from operating until, they had to install safety measures or do testing or additional engineering that wasn't required by any standard, but the agency held them to that and wouldn't lift the K order until that extra work was done. And that was back in January. So why are we looking at all these slides? We're looking at them to see where we came from to get to an idea on where we're going. And I was really interested when preparing for this to say, does it really mean that if it's a Democrat in office in the White House, how is it going to affect everything else? Because honestly, Eric and I have been doing this a while, and we were pretty busy during the Bush administrations, and that continued through the Obama administration. So it's just interesting to look at the trends. And looking at those trends, we think there's going to be at least an initial increase in enforcement that will hopefully dip back down. This is going to be especially true if there's an emergency temporary standard issued, which a bunch of you have probably heard about. And there was an executive order that Eric's probably going to talk about coming up that, it may lead to an emergency temporary standard about COVID. In fact, many clients are calling us saying they're being asked by district offices to provide them with their current COVID mitigation plan. I'm not sure if you've had that experience or not. We believe that that is the agency looking at whether or not they need to issue a temporary emergency standard on COVID. So I definitely would expect some increased enforcement. I don't know of any enforcement on the COVID-19 issue from MSHA. And Eric's going to talk about whether or not state and local agencies are doing that more. During the last 4 years, I think we really have seen a decrease in 110C investigations that look at supervisor liability under the Mine Act. And we've also seen a decrease in 105C whistleblower complaints. And we expect both of those will see an increase. We also project there'll be a potential warmer audience for organized labor concerns such as hazard complaints, which of course MSHA always has to investigate no matter who's in the White House. So that's not to say this is all bad news. Even after the citation numbers peaked during the first year of the Obama administration, there was a steady downward trend after that. So that's our projection coming forward. And now I'm going to hand it over to Eric. Can you hear me, Eric?
Yes, I can. How about Donna? Can you hear me? Great. Thanks, everybody. Folks, nice to speak to you all virtually. Let's kick off and continue the discussion that Donna started on MSHA's rulemaking agenda. And I will confess I'm going to geek out on the first couple of slides, much the way that Donna did with the charts. That's what we tend to do. But what I wanted to point out is we're 12 days into the Biden administration. And at the moment, there has not been any substantive rulemaking that has come out for MSHA. But what we have seen are a flurry of executive orders from President Biden. And it's worth noting that an executive order is binding on the agencies. Those are not, they don't have the legal effect of law that would apply to private citizens. And there's no enforcement action that can be taken directly from an executive order. That said, executive orders are instructive for the private sector because they show what the White House wants its executive agencies to do. So it's worth talking about at least two of them. On January 21st, one of the executive orders that President Biden put out is protecting worker health and safety during COVID. I will confess that the bulk of this executive order is focused on OSHA because most of our private sector industries and businesses are regulated by OSHA. First thing that the order asked is for OSHA to publish guidelines within 2 weeks that would look at COVID and try to address and control mitigating hazards and health concerns. OSHA met that deadline and they did publish the guidelines last Friday. If any of you attended the SBA virtual roundtable last week, where Jim Frederick, he is the nominee to be the Assistant Secretary for OSHA, he did point out that those are not mandatory requirements as of yet. Those are guidelines. They are, in a sense, voluntary. They are advice for employers regulated by OSHA to follow. Where we see the transition is in section 3C as in Charlie of this same executive order. That is the paragraph that talks about directions for the Secretary of Labor with regard to mine safety and health. And it directs the Secretary of Labor to consider whether emergency temporary standards on COVID that would be applicable to coal or non-metal mines are necessary. That decision is still being evaluated. If you've attended other trade organization conferences in the last couple of days, the feedback that we have received is that Pat Sylvie, that Donna mentioned earlier, is currently, in a sense, the acting leader and head of the agency. They are evaluating and looking at the criteria to decide whether an ETS for the mining community is necessary or not. So we are all in a bit of a wait and see mode when it comes to that topic. In addition, the other part of the executive order talked about regulations for the Department of Agriculture, Department of Energy, Department of Transportation, Health and Human Services, and state and local governments. I realize that is not germane to the mining industry, but it's worth taking into account and thinking about the fact that the Biden administration wants to make sure that there aren't any gaps in the COVID protections for workers, regardless of what industry they're in or who is regulating them. So they are trying to be broad in their reach to make sure that there's a consistent level of protection that they are putting out there to protect workers across the board. So the next rather detailed and geeky slide is up there for you. I apologize that this is a bit of a dense read, but this executive order has not received all that much attention. but it's titled Modernizing the Regulatory Review. We find that this topic is interesting because this could be a noticeable shift in how agencies will have to proceed when they are devising and publishing new regulations that would be binding on the private sector. Since 1981, when President Reagan issued the first executive order, he directed the Office of Management and Budget, which is OMB, and the Office of Information and Regulatory Affairs, OIRA, to perform a cost-benefit analysis when they were looking at proposed rules from agencies, so that you did have a quantifiable, numerically driven assessment of what the cost to the industry would be and what the benefits would be that were being attained. With this executive order, President Biden is shifting that calculus a bit. And he's not the first to do it. It was done under the Clinton administration, under the second Bush administration, and under the Obama administration as well. And then many of you may recall that former President Trump had the 2-for-1 rule that he had ordered the agencies to follow, where if they were going to publish a new regulation, they needed to find 2 obsolete ones to rescind. So the concept here is not unique, but the criteria that President Biden has directed OMB and OIRA to look at, I think, are worth noting. Right around the middle of that slide, when it comes to the policy objectives that OMB should consider, the calculus should be looking at promoting public health and safety, economic growth, which is obviously important to the private sector, social welfare, racial justice, environmental stewardship, human dignity and equity, and I found interesting, the interests of future generations. The same executive order acknowledges that some of these criteria are going to be difficult or impossible to quantify. That means that as regulated entities are looking at new rules and maybe considering how you want to frame your comments or your opposition or initiate a legal challenge to those rules, the strategy and the factors that we may bring up are probably going to shift. So those may be things that you want to be looking at as far as the factors to include in comments on future rules. Ironically, on January 27th, so this past Friday, as an additional executive order was written that President Biden has directed that scientific integrity and evidence-based policymaking be the criteria under which regulations and his administration operates. So we can certainly see some tension or some conflict in those what could be competing goals of these non-quantifiable or aspirational objectives that come out of certain rules, but also the need to be able to focus on the science and the data-driven evidence that would go into formulating of those rules and future regulations. So that is, in a sense, the marching orders that the White House has given to the executive agencies. When we look at COVID and an emergency temporary standard, as Donna mentioned, this is out there, in a sense, being considered right now. OSHA is currently the lead agency on moving this ball forward, but MSHA, as we noted, is looking at it, and they have been requesting information, as many of you have mentioned or have experienced. As of January 29th, OSHA's in that SBA advocacy roundtable acknowledged that they have not made a decision on an ETS, but that doesn't mean that they won't before March 15th, which is their deadline to make a decision. So we are all in a bit of a wait and see mode at the moment. One of the other factors I think that is going to be important for you to keep in mind is what kind of record keeping are we going to be looking at the agencies imposing on the private sector. There has been discussion on whether or not vaccine reactions would need to be a recordable event. And obviously the devil is going to be in the details there on whether an employee is receiving a vaccine out at the local hospital or the medical clinic, or if it is done through a large employee vaccine drive or something like that. But we are going to need to continue to monitor that and see where the agencies come down on their decisions.
Hey, Eric?
Yes.
We just got a question. It kind of goes well with that last slide. Someone asked, have the MSHA sites experienced elevated levels of COVID cases that would warrant additional orders, guidance by the Secretary of Labor, which is a great question. We've worked with mines around the country. Of course, nobody needs to tell MSHA unless it's reportable that there's been an outbreak, or if, some people get it, they might have gotten it from community spread. So in that case, it wouldn't be reportable. I haven't heard significant levels of COVID cases at mines, kind of akin to the meat packing industry. And the largest outbreak that I've heard of was at a mine where they believe the MSHA inspector brought they brought it to the mine, and I believe upwards of 20 miners. They weren't wearing masks, and it was several months ago, and hopefully everybody's wearing masks now, but the inspector himself was the cause of that outbreak. But that's a great question, if you have anything else to add.
No, ironically, the anecdote that you just mentioned is what I was thinking of, because the MSHA inspectors are the people that are going to be moving between communities, between states. They are probably going to be exposed to a more diverse population group than your miners that may be limiting their activity away from the house. We recognize that everyone is human, and there are going to be instances where there is additional contact that an employer can't control. But by and large, you have the ability in your mind to put some of those engineering controls in place, the administrative controls in place, stagger how your workforce is arriving, how are they, when they're getting on the cage, et cetera, and take steps to reduce the likelihood of an outbreak at your job site or at your mine. The interloper would be the mine inspectors, and hopefully they are continuing to cooperate and follow some of the protocols or the risk mitigation steps that you've had in place. I think there was a bit of a learning curve at the start for inspectors where they may have resisted or chafed at some of those ideas. Lately, at least for the clients that I've spoken to, I have not heard that being a perpetual problem, but if it does arise again, please feel free to reach out. So what does the CDC and OSHA already say? A lot of these steps are probably old news to you and things that you've done. Did you implement your COVID response plan? Are you looking at and assessing where the risks are? Is the plan written down? Is obviously another step to take into account. And then what measures are you able to put in place for your general employee work, population, as well as measures that are job specific? The other advice I would have, we didn't put it on the slide because it's going to vary so much, but really pay attention to your state and your county governments and what they are saying. We've had recent discussion with mine operators that are clearly regulated by the Mine Safety and Health Administration, but out of the blue, they receive a phone call or a letter from their state Department of Labor asking about their COVID protection measures and the steps that they put in place because they received an employee complaint at the state level. We've also seen it at the county level, where the county public health department contacts an operator and asks for information. By and large, these events have been relatively cooperative and have not resulted in any sort of adverse complications, but it did cause the business to have to reallocate resources to grab papers and send them off to a different arm of the government than you're normally used to interacting with. So be aware of it. It's probably best to have your thoughts in place on how you're responding, and then politely remind them in the cover letter that you are a entity that is regulated by the Mine Safety and Health Administration and are following the mandatory health and safety standards that you are required to, but as a courtesy, here's the info that you requested. When it comes to reporting COVID cases, from the former Secretary Zatazelo, he really did look at the idea that it needed to be demonstrated to be a case that was contracted at work. And as Donna mentioned earlier, those are difficult things to determine because of the amount of interaction, and as the variants in the virus have infiltrated the United States, people are finding that they are contracting it away from work. But then the question is, once the person has contracted it, and if they arrive at work being asymptomatic, are they at risk of spreading it within your workforce? So that's the determination. With California right now is, I think, the prime example that I'm aware of, where you have a state plan and state guidance that is more restrictive than what MSHA has required, and you have shared jurisdiction between the California State Occupational Division and federal MSHA. There, an employer that has employees testing positive for COVID need to report it to their workers' comp carrier, and the workers' comp carrier in California does the investigation, as opposed to you being involved in it. And there is the potential that what a employee who is out sick with COVID, they might not give all of the information or the context behind how they contracted the illness, and they may have selectively not shared information with the comp carrier that you as the employer may have. For the example being where I dealt with it was a rash of COVID cases for an outdoor construction company that took place 5 days after Thanksgiving. So was it really work related and contracted at work, or had it been multiple family gatherings over Thanksgiving and everybody came back to work at the same time?
Oh, Eric, I'm going to jump in with one more related question.
You bet.
And that's asking if we're going to be required to report reactions to the vaccine, and if so, will there be any criteria that actually qualifies what a reaction is? My thought is that MSHA is not going to want to get involved in that game as far as reactions to a vaccine. What do you think?
I think it's an excellent question. That did come up in the colloquy conversations with the SBA roundtable last week. And in fairness for the officials that were answering the question, their thought was off the cuff. So I don't think it would be appropriate for me to attribute or say that it was formal policy. The best thing to say is they're looking at it. And the devil, I think, will be in the details to say, was the reaction to the vaccine work related? And I'm struggling to imagine where the federal government is going to say that receiving the vaccine, which the federal government can't mandate, would be a work-related event and therefore have to be recordable. And I agree with Donna with your thought that I don't think MSHA is going to want to be into that conversation, and the complications that come from it across employee health, privacy, and other matters, I think are going to be an added wrinkle that we'll have to see. So I'm hoping that OSHA and MSHA and other safety-related agencies take a step back from that, and it's going to be another wait and see question, at least for the next week or two or I guess 5 weeks until March 15th, when we see if there is an ETS and then what it says. Looking at this slide here, you've got the two maps of the United States. This is purely for illustration. And what I wanted to point out again on the suggestion to think about the state government requirements, the county government requirements where you are, is to look at the disparity or the split in how state OSHA entities versus the federal Occupational Safety and Health Administration handled COVID complaints. The newest data, or the most recent data we had when our group put the presentation together last week for OSHA industries, at the federal level, all inspections is the right-hand map for 2019. And you can see that it was almost a 50-50 split between state inspections and federal inspections. But when you look at that map on the left, you can see that these state entities were doing far more inspections and inquiries related to COVID than federal OSHA was. So just for the comparison, that was the reason that we put it up there. So you can see that it's not far-fetched to be in a situation where you're getting a phone call or a letter from a state government. What other things do you need to be thinking about? Here are some of the steps and the suggestions that we have for responding to a state ETS, if you are looking at one, Virginia being one example, California being another. This is not the master list. You really do need to look at the state where you are operating, see what they have required, and then factor it into your plan. So these are much more just illustrative examples of the considerations that you should be thinking about. What else are we going to have to do as the vaccine is reaching more people's arms, and we have a larger percentage of the working population that is vaccinated? This was, I thought, an interesting aspect, and it might be counterintuitive. I have a family of animal science and biology majors, and this winds up being either the dinner table conversation or the FaceTime and Zoom conversations for those kids that are on the East Coast that are studying it, was whether the vaccine that is addressing COVID, both the Pfizer and the Moderna, are stopping infections or controlling symptoms. And this, from a technology standpoint, and I will confess that I am a failed electrical engineer that wound up as a poli-sci major. So take what I say on the science with a large grain of salt. But the research and the focus of the testing that was done for this messenger RNA type of vaccine was looking at minimizing the severity of the illness for the person that receives the vaccine. So the research that has been done so far with the time that was available was focused on controlling and preventing the symptoms and making sure that it was safe to be received. It did not yet study the level to which the vaccine will prevent the infection or the transmission from a person that didn't have the vaccine to a person that has the vaccine, and from the vaccinated individual to somebody else. That is a bit of an unknown question. We are seeing more coverage and discussion about that. And obviously, if you're on the 2-stage vaccine, there is going to be a time window during which you may not have the full efficacy of the vaccination as of yet. And that's partly why the government and the safety agencies are continuing to push to have some of those other administrative and policy controls in of social distancing, face coverings, and other steps. So we'll be listening to the scientists as they go. And my analogy out of my aviation background is, the entire planet right now is, in a sense, building the airplane as we're rolling down the runway. So we're all going to be learning and adapting as the science and the data unfold and discover new things. So the resources we have up here are available to you and are going to be part of the materials that we put out for you as a complement to come with the webinar. And hopefully these resources are going to be useful to you. The last topic, and again, without an Assistant Secretary for Mine Safety, this is a bit of an unknown, but former Secretary Zatazelo was very focused on blurring the lines and eliminating artificial distinctions between the coal sector and the metal non-metal sector. We're not aware of any indication that philosophy is going to be undone or reversed. So for the moment, I would say that we are still at the status quo. There are going to continue to be questions on the coal inspector's familiarity with metal, non-metal industry, the mining cycle, the geology, et cetera, the differences in the rules. And then, as many of you have mentioned during our conversations and our coalition discussions, the level of experience that the inspectors have nowadays versus previous years. But from a policy standpoint, we have not seen any indication that the blurring concept is going to be undone. And the last slide.
Sorry, and I'll just jump in for a quick second and just say, I did talk to what I'll call a senior MSHA administrator who's still with the agency. Again, we don't have a head of the agency right now, but he agreed with what Eric said and said, the wheels are already in motion for the blurring. We know, because I talked to him, how painful it is for some of our clients who are getting inspected by coal mines and vice versa. And one of my coal mine clients is getting inspected by metal, non-metal, and it's very difficult on operators. And he understood that. He thinks that things are going to get better in about 5 years with more training, which isn't really a consolation, but he doesn't think they're going to be, at least from his perspective, kind of going backwards on that. They'll probably stick with it.
Thanks, Donna. So the last slide that I'm going to cover before returning the microphone to Donna is going to be just where is the regulatory agenda as far as work that's been proposed in the past and whether it will continue with the new administration or not. So this slide shows you the concepts and the topics that were out there that Assistant Secretary Zatazelo had put in place. And we're, again, not aware that any of these would be pulled back. If you were a listener or in the audience to have heard Secretary Zatazelo talk about silica in the previous years, it was a topic that he felt strongly about. And obviously OSHA has moved forward in that direction as well. I fully expect that the Mine Safety and Health Administration under President Biden will do the same thing. And what else? I just had a thought on this and I completely went blank. I'm sorry. Yeah, I went totally blank. I had some wonderful pearl of wisdom and that I was going to add in as a thought, and it just slipped my mind. Okay.
Well, you can interrupt me with your pearl of wisdom when it comes back.
I appreciate that. All right, Donna, why don't you take it from here?
Sure. Next few slides, we're going to talk to how to prepare for these potential new changes. Somebody who's listening just wrote in, and this will kind of go into my COVID compliance tips. He said he's worked for MSHA for 9 years up until a week ago, and that the COVID complaints MSHA's received targeted housekeeping as a regulatory response, which I think is interesting. I hadn't heard that yet. He's saying that they do collect data on how many miners are currently positive with COVID-19, but it is data collection only. And that makes sense. I mean, that it's data collection only. I think, honestly, they were collecting a lot of the data for their inspectors to see if they should be coming to the mine if there was an outbreak. But now the data collection, I think that happened starting after January 20th, has been whether or not we need any kind of emergency temporary standard. So what can you do to prepare for what's coming? I recently spoke with a client who kind of mentioned that they didn't have any policies for the office on where to have, if you need to wear masks or not. I think we're past that. I think everybody needs to have a COVID mitigation plan on paper, and not just on paper, you actually need to follow it. So if you don't already have that, we have tips online on what you should put in your plan, but you absolutely should have a plan by now. And you should be asking people to wear masks and do your social distancing and all the things that the CDC requests. You have to follow your plan. Vaccination policies, I don't think they're a great idea as far as mandating your employees to have vaccines, just because of the huge amount of problems you'll have with people saying that they shouldn't get one because of either religious or medical reasons, or maybe other just objections to it generally. I think it's going to be a big headache for employers. I think it makes more sense for outward facing companies, say that face the public on a day-to-day basis, like being in a Best Buy or being in a restaurant or any kind of retail operation. But I don't see it being an easy policy, because then, you're obviously going to have to terminate people who don't want to get the vaccine, and that could mean you're terminating good employees. So I think there's some hardships that go with mandating a vaccine. You're going to want to continue to train everybody on, all of these basic things we've been hearing about since March: washing your hands, keeping your distance, wearing your mask, doing what you need to do to keep everybody safe. And that includes monitoring and all of the compliance and supervising all of your employees, making sure they're compliant, and recording if you need to discipline people, and hopefully you don't, but at least record that you're counseling people, show that you're enforcing your rule. You also want to be aware of your state and local laws and regulations. Like Eric mentioned, in California, they have their whole other set of rules about reporting to their health departments if you have a certain amount of people who test positive. So every state is going to be different. And Eric already covered the illness recording and reporting rules. Up until now, it's been a suggestion that it's just too hard to prove whether or not miners got COVID at the workplace or not, or if they got it from community spread. That may change, but for the moment, there hasn't been a lot of, I think, demand for reporting just because it's so difficult to determine where the virus is coming from. Other tips for compliance and any upcoming rulemaking, which Eric mentioned, could be a variety of things, including silica, which we expect. Prepare comments. You are allowed to prepare comments in the rulemaking process. We do it as a group for the coalition sometimes. You could do it individually. So if you have any information, I'm sure you do, that the agency would be could learn from as far as making a rule or changing a rule, I think it's important that you comment on any new rules. As always, your relationships are key with the agency. If you have a new group of inspectors, a new field office supervisor, I think it's time well spent if you reach out to meet these folks and establish a relationship. Also, you know, take the time to show your great safety record, to talk about your programs and educate them on all the great things you're doing at your site. You always have to continue to enforce your safety rules. Having them on paper and not enforcing them is worse than not having the rule at all. You need to enforce your rules and show that you enforce your rules. As always, but just as a friendly reminder, if you're terminating or issuing any kind of discipline, keep good records. That might mean a witness statement. That might mean, you know, this is what I saw. I investigated it to make sure what I saw was correct. And then I issued the following discipline. Make sure you keep a record of what you're doing, because if there are increased 105C whistleblower complaints, you're going to need those records. And then continue to keep good records of inspections with side-by-side photos of the inspector. You know that you have a right to be with the inspector. And I know you all do that, and you are there asking questions with boots on the ground, saying, why are you writing this? Why is it S&S? Why is it fatal? Ask those good questions right there. And then, you know, take notes, because we could need them later if you want to challenge any of these citations.
Hey, Donna, can I jump in?
Sure.
And because before my memory fails me again, I remembered that pearl of wisdom. And in truth, it was much more of a historical reference. And when you mentioned Mark Savitz's slides before with the bar graphs, it reminded me of a historical aspect that Mark gave to me when I started working for him about rulemaking and the differences between the administrations. And about the trend that our group at least had seen over the 30 and 40 years that Mark and Henry had been in this area, and then, you know, mentoring and training Donna and Avi and Brian and me, was the Republican administrations were certainly groups that would enforce the existing regulations, with the philosophy or the approach being that if they were enforcing the regs, they wouldn't need new regs. And Democratic administrations may be more likely to be under the belief that times have changed, it's time for a new rule. So with that idea that Secretary Zatazelo's list of existing regs that were in progress, one of the reasons of that, at least I anticipate that those will continue to move forward, is that aspect of the industry has evolved, technology has evolved, available safety and protective measures are more common, perhaps, or more mainstream than they were in previous years. It's time to update the regs. So much more of a historical reference or vantage point by which we can think about where they may be headed with the regulations. But that's where I was going to go in my mind when my mind went blank.
Well, thanks for sharing that, Pearl, Eric. I'm glad you remembered it. So we've got another question. This is about what I was just talking about, and Eric as well. What's the basis of the requirement for a COVID response or mitigation plan? Does it need to be written, shared? What needs to be included? So right now, there is no requirement for you to have a plan, and that it's an enforceable reg. It is a suggestion that has been suggested by the CDC for months. And the fact that I think I mentioned earlier, MSHA right now is emailing around to ask operators for their COVID mitigation plan. I think they're, you know, if I'm being probably more optimistic, I think that they're asking for that to show that they don't need a rule because you already have one. I don't think you right now could get a citation for not having a COVID mitigation plan. Does that mean you shouldn't have one? No, I still think you should have one because it's a safety issue. It's going to keep your miners safe. What should be included? I can tell you that, you know, it's the basics. There's a whole section on the CDC website that I can email you that gives you the tips, and they're the obvious ones, right? It's, you know, if people can't be socially distanced, can you put barriers between them? Do they have masks? Do you have hand washing stations? Are you encouraging everyone to wear their mask, wash their hands? Are you encouraging social distancing? It's not, I don't think it's very onerous, let's put it that way. And that's from someone who's been kind of studying and advising on the new Cal OSHA rule for the last month, which I could tell you is very onerous and very difficult to comply with. So I'm guessing most of you already do everything that's listed on the CDC guidance, but to the gentleman who emailed us about this, we're happy to send you the link later on. Okay, let me look to see if there's any other questions. I think we have a lot of them answered. And we've got 9 minutes to spare. So if anyone has anything else to ask, we're happy to answer anything. But I do want to say that just thank everyone for joining us. We hope this information was helpful. We have on our calendars, and we're so excited, and we hope these variants don't get in the way of the upcoming Industrial Minerals Association meeting in Park City and the Rocky Mountain and Western Safety Conference in Vegas in the fall. We're so excited to see everyone. And, you know, if you're there and you see us, come say hi, and we promise to take you out for a drink or some coffee or something and be normal and talk with people face to face. We're so excited, and I can wear shoes that aren't flip-flops. It's going to be fabulous. So I just want to remind everyone this program has been approved for legal education hours, and to report those hours, you click on the CEU icon at the bottom of the screen. A certificate of attendance, including course numbers, will be emailed to you tomorrow, along with a recording of the webcast for watching and sharing. And be sure to complete our short survey, and we use your feedback to plan future programs that are applicable to your business needs. This concludes our webinar today. So great to talk to everyone, and have a wonderful and safe day. Thank you.